My Health, Our Future is a research project that aims to understand the mental health and emotional well-being needs of secondary school children in Suffolk. Further, this project also aims to find out what students know about the availability of support for mental health within their schools, as well as what they know about mental health services provided by the NHS and voluntary sector organisations, and whether they feel able to access those services.
We're asking young people about a whole range of different topics which affect their mental health and well-being, ranging from exam stress, anxiety, body image, self-esteem, and how much sleep they're getting, and also how much time they're spending on electronic screens. Also, through talking to teachers, we've found out what a big problem social media is. And a lot of the staff are saying that most of the problems they deal with are caused by or linked to social media. So we thought it was really important to include a social media section in the survey to find out what young people really think about social media and how it's affecting their well-being.
As well as giving an individual report to each school participating in My Health, Our Future, the results and recommendations will influence the Children and Young People's Emotional Wellbeing Plan 2020. This ensures that children and young people's voices are heard in the right places to make a difference to mental health and emotional wellbeing in Suffolk.
So we commissioned Healthwatch to help us understand how schools were able to support young people with their emotional wellbeing and mental health, and it enabled us to have a really strong evidence base that we've been able to take forward and co-produce a set of recommendations.
It's a really good way of understanding directly from young people and children how they feel about their own health and well-being. And it gives me, in public health, an understanding across all of Suffolk, really, all the young people across Suffolk. And the more schools that are involved with that, the better, because it gives us that idea of differences across the county. So we don't know it at an individual level, but we get a whole sense of our whole population of children and young people. And then we can understand what we might need to do, what we can do to make things better.
A lot of our schools wanted to feel more confident in having conversations with young people about their emotional wellbeing and mental health, because it's often quite a daunting conversation. So this project really helped us to explore what better support we can put in place, both for the young people but also for schools.
I think it's important to know the difficulties that young people face in terms of emotional well-being, because that way we can kind of help them to develop services. It's also important that young people have a voice so they can feel heard.
I personally think it's a good idea because you will find many young people don't know where to go. It will be beneficial for the school and other people to find a way to help them and to understand what young people are actually looking for.
We've been very keen for a long time to try to improve the support we're able to give our pupils and students, particularly as the external support from the health service in terms of mental well-being has diminished, and that's a big issue for us really. So we decided we would take part in the pilot survey, but I was also really pleased to find out we were able to compare the outcomes for our students against what you might call norms. The next thing really is to say, well, looking at the characteristics of our own students, what can we do better in order to support them more? So we've incorporated findings from the survey within our annual school improvement plan, and we've been able to build in a programme over the next 12 months of various things that we would like to do, which we think now, based on evidence rather than just a gut feeling, will be of benefit to our pupils and students' well-being.